Hey guys, Alex Winder here from Blue Wave Insurance. Today we're going to talk about the different Medicare enrollment periods and how each one works. So the first enrollment periods we're going to talk about have to do with signing up for Medicare A and Medicare B. And the second set of enrollment periods will deal with the Medicare Advantage plans, supplement plans, and the prescription drug plans. So for signing up for Medicare A and B, the first enrollment period we're going to talk about is your initial enrollment period, which takes place around your 65th birthday. So assuming you're going to start Medicare when you turn 65, you'll have a 7-month window that starts 3 months before the month you turn 65, lasts the month you turn 65, and then lasts an additional 3 months after the month you turn 65. So that's a total of 7 months you have a window to sign up for Medicare A and Medicare B if you're going to go on to Medicare when you turn 65. Now, if you're not turning 65, let's say you're 67, 68, or you're just over 65 and you've delayed Medicare due to employment, so you'll have a special enrollment period to come off your group plan and pick up Medicare without a penalty as long as you've had credible coverage and you've been actively working. That special enrollment period, technically you have 8 months to enroll in Medicare Part B after your employer coverage ends. But I say almost everybody will just enroll into Medicare as they're coming off their group plan. So usually the last 1 to 2 months of their group coverage, they'll enroll into Medicare. So it starts right when their employer coverage ends and there's no gap in coverage. The third enrollment period we'll talk about around getting Medicare A and B is the general election period. This period takes place January 1st to March 31st of each year. This is the enrollment period to use if you need to get Medicare Part B and you don't have a special election period to use. You can get Medicare Part B during this time, or if you're not eligible for Medicare, free Medicare Part A, you can get Medicare Part A during this time as well if you're not eligible for the free Medicare Part A. So January 1st to March 31st, you can get Part B if you don't qualify for a special election period. And normally, if you have to sign up during this time, you will have a late penalty as well. So that is the general election period to sign up for Medicare Part B or Medicare Part A that is not premium free. It's important to note that if you are eligible for free Medicare Part A, then you can sign up for it at any time. So free Medicare Part A would be if you've worked for 10 years, you've paid into the Medicare system, you would be eligible for free Medicare Part A. You can add that anytime once you're 65 or eligible for Medicare, and there's no late penalty if you're eligible for free Part A. It's the penalty that can occur on the Part B side if you don't delay it correctly or if you don't sign up on time. So let's talk about the enrollment periods around getting a Medicare plan, such as a Medicare Supplement, Medicare Advantage, or drug plan. The most popular enrollment period would be, again, around your 65th birthday, that initial enrollment period, 3 months before, a month of, and 3 months after the month you turn 65. You're able to get a drug plan or a Medicare Advantage plan. Also, if you're going to get a Medicare Supplement plan, you have a 6-month window to get a Medicare Supplement plan. No health questions asked. That starts the first of the month you turn 65 and are eligible for Medicare Part B. If you delayed Medicare and you're starting Part B after you turn 65, you'll be able to get a Medicare Supplement plan without health questions during that 6-month window, starting the first of the month you start Medicare Part B. Now, another popular enrollment period is annual enrollment period, which takes place each year starting on October 15th and goes to December 7th. During this time, you can change your drug plan, you can change your Medicare Advantage plan, you can sign up for a drug plan or sign up for an Advantage plan. That's a time you can make changes to those plans, Advantage plans or drug plans. After AEP, there's another enrollment period called Open Enrollment Period. It runs January 1st to March 31st. During this time, you can make a one-time change from one Advantage plan to another Advantage plan, or you can drop your Medicare Advantage plan and go back to original Medicare with a supplement plan if that's what you want to do. So OEP, or Open Enrollment Period, refers to folks who have an Advantage plan and want to either change their Advantage plan or drop their Advantage plan. So far on the Medicare plan enrollment periods, we've talked about being new to Medicare. 7-month window applies to signing up for a drug plan or an Advantage plan. If you're going to do a Medicare supplement, that's a separate 6-month window, goes off your Medicare Part B date. During that time, you can enroll in a Medicare supplement plan without any health questions. Annual enrollment period, also referred to as AEP, that runs October 15th to December 7th. You can make changes to your drug plan or your Medicare Advantage plan. And then there's OEP, open enrollment period, applies to folks who have a Medicare Advantage plan and want to make changes to those plans. January 1st to March 31st is OEP. Lastly, there are several special enrollment periods that apply to Medicare Advantage plans and Medicare supplement plans and Part D drug plans. The most popular ones are if you're moving with your Medicare Advantage plan, you're moving outside the service area, you can get a new Advantage plan or you can get a Medicare supplement plan. If your Medicare Advantage plan is terminating and not available for next year, you're able to get a new Advantage plan or a Medicare supplement plan. So those are the two most popular special enrollment periods when it comes to the Medicare plans. There are some other ones out there like losing Medicaid or having VA coverage or coming off an employer, for example. If you have questions on your Medicare coverage, give us a call at the number below. We'd be glad to help you out. Don't forget to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.